Sometimes individuals that are a little bit later in life ask us whether or not there's special considerations or risks for getting top surgery when you're in your 50s, 60s, or maybe even 70s. We see patients of all ages from their 20s, 30s, and 40s and on up. And I can say that by and large, there are not many considerations that play in just because somebody has a particular chronological age. So things that we think about for surgery are the degree of elasticity that is present or absent in the tissues. And of course that might change as somebody gets older. There might be less elasticity. The tissues might be looser. The quantity of tissues, and in some cases whether or not the patient has been adequately surveilled for the potential risk of breast cancer. But these things don't have to do with exact chronological ages. These are elements that we would evaluate for people at any age. And I haven't noticed that people that are older have an increased risk of like wound healing problems or issues specific to the success of the surgical procedure. So I really think that when we think about people that are later in life, I mentally sort of subtract out the chronological age consideration. We look at them as to whether or not they're healthy enough to undergo surgery. We look at their tissues as to whether or not any particular approaches are more appropriate for those tissue types. And using this approach, we've seen things be just as successful at the older ages as we've seen in younger aged individuals.